So, Minister, I'm really glad that you guys are breaking it down by culture. It absolutely makes sense in 2023 to be able to do that. To your point, there's a stigma. So, is that infrastructure of support in place today? So, for our viewers that are listening to us today, where can they go to find that support? Do you have a website? I know you mentioned Roadmap to Wellness. Is that a document? And
Yes.
where can they get access to that?
Yeah. So if you go to ontario.ca/mental health, you'll see all the different documents listed there in terms of what we've done to date. Then, if you look at as well for supports on the same page, you'll see a plethora of investments that have been made and programs. So we have virtual programs for people that don't want to leave their home and don't want to be seen or feel uncomfortable in sitting face to face with someone. We have something called Ontario Structured Psychotherapy, where we invested $20 million. And anyone in the province of Ontario who needs psychotherapy can get it free of charge with their OHIP card, not their credit card. And they're able to get 16 sessions, which is extremely useful. These are face to face. We have programs for nurses and frontline workers where they can log on, and it's specific to their needs because they as well are a cultural group that need to have their own supports and services. Doctors, frontline, again, these are frontline workers like our first responders. They need to have their supports. You'll see that there are programs for children and youth. You'll see that there's a the kids help phone is a huge part of what we do. They've seen now hundreds of thousands of kids, actually not seen them, but spoken to them. There's a texting service that they use. As young kids, they don't really want to, they text. So that service is being used, and it's doing extremely well. The other place to look beyond ontario.ca/mental health is Connects Ontario. Connects Ontario can give you a live, just-in-time picture of services that are available. So if you need to have a bed, if you need to have an outpatient service, they will give you the contact information. I think they even go as far as setting up the appointment. They're very focused on making sure that the person gets the support they need, including where we've got situations, unfortunately, with suicide ideation. We have a lot of that happening now, more so than ever. And there's a lot more young people that are actually completing suicide than we've ever seen. And this is a demographic 17 to 24, which is extremely disturbing to me as a father and as the Minister for Mental Health and Addictions. So we're doing and focusing with suicide helplines. We're doing what we can to ensure that the supports are there and that individuals are getting the help they need. At the end of the day, hospitals are not the right place unless it's acute case. They're not the place to go to get help. And so when there's a mental health issue, everyone goes to the hospital because we've been trained that if there's a problem, you should take someone to the
Mhm.
hospital. When you get there, those services are not always adequate to help the individual because the hospitals are really not equipped for the majority of the cases. And so we need more supports in the community. And the websites I give you access to the supports that are available in the community. Is it a perfect system? No. But the Roadmap to Wellness is giving us the ability to see where the gaps exist, and with the funding we have available, fill those gaps so that over the course of time, we'll have a system that truly looks after everyone where they live, as opposed to having to send them, long distances.